She's a doctor, anesthesiologist. We have so much fun in the OR together, and she's amazing. Can we tell people your age?
Yes, I'm 59. I'm turning 60 this year.
And I just want you to notice the vitality, the glow. She looks very supported. All the skin's in the right place. Firm, taut, and toned. That's Sculptra. And we decided you'd had maybe 10 years of Sculptra
10 years of Sculptra. Yeah,
that is
with
awesome.
Dr. K.
Awesome.
Because she's the best.
She's so sweet. She comes from far away to see me now that she's out of the hospital. And she has gone to Antarctica and climbed Mount Everest. And like, I am so impressed. I'm so jealous, but I could never do that. But I'm wearing my weighted vest today because she's like, she goes around with her backpack. So this is my version. So 10 years of Sculptra is kind of incredible, but you guys, some people are worried about, is Sculptra going to mess up my face? Is it going to make it hard to have a facelift later? I just want to show you that perhaps you may not even need a facelift if you do this kind of maintenance, because actually zoom in close and look at this neck. This is beautiful. Aren't you proud of this?
That's Sculptra for you. I'm not ever going to have a facelift because I'm going to continue to do this Sculptra.
And you've been in the OR, so you know what surgery is like.
Yes, I've done anesthesia for many a facelift.
Yeah, and it's just not for everyone. Like, not everybody wants to go that route. And if you don't want a facelift, it's okay, because look how good you can look, and quite natural, not, you don't have to get a filler face. This is collagen biostimulation. So today we're going to do more Sculptra. I am going to add a little radius to the cheeks because that'll give us some instant lift, and that'll help tighten you here. Pull this vector up, and then hello, telephone. Is that my phone?
It's probably mine.
Oh, it's your phone. Okay, that's okay. Jones. It says Jones.
Oh, that's my son.
Ryan, do you want to talk to him?
Yeah.
Okay.
Back.
Well. So we're going to do Sculptra for the high volume areas like temple, so giving us this vector of upper lateral lift, this preauricular area, and then right in here the pre-gel. And then we're going to do a little bit of under eye, soft filler with Bellatero, lots of neck Sculptra as well. Everybody's calling. We're very popular right now. We're very popular right now.
Lunchtime. Everybody's taking a break and calling.
All right, let's see. I'll do some quick markings and then we'll begin. Don't mind me and my weird vest. Okay, open your mouth nice and big. And you don't even have much in the way of temple hollow because that's something we're also really keeping up with. I'm doing this temporal vertical vectoring study where I'm putting Sculptra in my temporal hairline, and that's turning out pretty awesome too. So maybe we'll feather some up really high because it turns out it really improves gel position. If you want.
Yes, please.
Make a kissy face. Okay, where do we lose volume? So this preauricular area, and then right in here.
Unknown caller.
Literally everybody's calling. All 5 of us give phone calls. Yeah, sorry, I'm gonna turn that off. That's funny. Good voicemail. That is funny. Great, and relax. Okay, what was it like to go to Mount Everest?
That's amazing. It's an incredible place.
Was it just like you felt like you couldn't breathe, or you prepared yourself with the oxygen and the hiking and endurance training?
It was easier for me than Kilimanjaro, actually, because I did do a lot of preparation. I took a lot longer to get there than Kilimanjaro. And I went to base camp. I didn't go to the top. So it's actually about the same height, a little less than Kilimanjaro. But I did climb to the top of Kalapatar, which is the next one, mountain over. And that's 21,000 feet, which is higher than Kilimanjaro.
That's amazing. And you feel comfortable and safe traveling alone as a woman? Or you're in big groups?
I'm in groups, yeah. I'm in travel groups.
But still, you gotta be very adventurous. I'm not that chatty. Do you have to chat with everybody all the time?
No, it's kind of, you can have solitary.
You can be solitary.
You can have some you time. I need a lot of me time.
Well, it's such a philosophical place.
Yeah.
And then how is Antarctica? I don't think I know anyone who's been to Antarctica. You're the first.
Antarctica was like the most amazing place I've ever been to on Earth. It was like not even being on Earth. It's so pristine and clean and
ethereal.
Yeah, unadulterated by humans.
Sounds kind of like heaven.
And beautiful, and also harsh. You know, it's got a definite harshness to it that you really can't mess with. Don't ever want to mess with that.
You can't. You have to respect nature.
Yeah.
Come in. All the interruptions. Quick pen. Yes, who's there? Okay, this is Sculptra, and we're kind of just volumizing in temples. We've marked out the zone where she's hollow. I'll usually do 2 or 3 small boluses, and I try to place one at the top of the eyebrow, a little bit higher, and then for you, I'm going to go into your temporal hairline because I think it's giving great results. I'm doing a study in the office right now where we're using Sculptra up high in the hairline to give a vertical facelift vector, and they've been doing that in Brazil for some time. Have you been to Brazil?
I have not been to Brazil.
What? Okay, now you've got places
I've
go.
got to go to Brazil.
Yes.
One of these days.
You gotta go to Rio. That would be fun. That would be a good 60th birthday, right? Antarctica is good. Sensitive right there a little bit?
No,
Not
it's
bad?
fine.
Okay. And how did you handle your skin in Antarctica? Was it like blistering cold? I feel like
Yeah, I got this
frostbite.
like this heavy duty, well, for one thing, lanolin. Got pure lanolin.
For your face?
Yeah, I have to put it on my face when I'm like that. It's a cold blister, not just like a cold and wind blister, not just like dry skin.
Mm-hmm.
There's something called warm skin that I used to be able to get, but it's not available anymore, and it was mostly lanolin.
Okay, now we're into your preauricular area right in here. Chin up slightly. So Sculptra is going to be a series of injections. Usually we'll recommend 1 vial per decade of your age. And so each time you come, after we did like her 5 vials, and kind of got that all in there over the course of 3 months or so, then the last 10 years it's just been maintenance. We see each other every 6 months, right?
Right, yeah.
Yeah.
I come down from Sacramento every 6 months.
Yeah.
And this is one of my most important stops. In addition to seeing my family. Yeah.
We book it. We have a standing date.
That's right.
And how does your face feel after Sculptra? A lot of people report feeling a Sculptra glow like a few weeks later.
I think it is glowy after that.
Yeah.
There's always a little bit of swelling, but that just lasts for like a day or two.
Mm-hmm.
Every now and then something will bruise, and that just lasts for a little while. But then it does have people just say, you look 20 years younger. What'd you do? And it's so subtle.
It's hard to put your finger on what's
Yeah,
different, but
it just
something
looks
looks so good.
Like I had a really good night's sleep.
That's awesome. And then here in the marionette, so this is where when we side sleep, our skin tends to, fold over and collapse and crease upon itself. So we're giving back some strength to the skin. When you're 20, you go to sleep at night and you wake up, it doesn't matter if you mash your face into the pillow, you still look 20. But when you get older and you side sleep, guess what? These kind of creases get set into the skin and the skin loses its, strength. So this Sculptra gives foundation support and strength back to the skin so that it'll stay kind of firm and not collapse. Less jowling, less of that, marionette folding there. All right, on a pain level of 1 to 10, how would you say? Can I have a new needle on that?
2.
2. She's tough. She's tough though. She can go to Antarctica. I would probably say. When I get Sculptra, I don't find it painful either. I feel like you just got to do what you got to do. And on a 3 or 4 of pinchiness, it's over fast. So a full face treatment might take 15, 20 minutes. And then we also use Sculptra. So in the neck, we're going to do 1 vial as well. It's great for décolleté, especially where we get like skin crinkles. And you can see her skin has some nice firmness there. It's not wanting to crinkle. But she does definitely put it through the elements, the sun, the wind, the cold. All these things break down collagen. And so the nice thing about collagen is you biostimulate and produce new collagen, which no one really can do that. You can't make new collagen unless you have an injury, a wound, or a stimulation effect. And that's what Sculptra is going to do. It's going to biostimulate. So in this day and age where people want to look really natural, it's such a great product. I'm going to enhance her little chin fat pad, and we're going to put a little drop here in that area where she's got a deep crease. A little pinch here, and there we go. All right, so that's half her face is done. I think that volume looks really good. And then we're going to go on to the other side. Apex of the cheek here. And then there. And do you guys have butt pictures too for her quote?
Yep.
Turn to this side slightly. Nice that you already are born with gorgeous cheekbones. That makes it easy. Just adding to nature.
I have no idea what I'd really look like if I didn't have all this help.
Can you
from
imagine how you would have aged differently?
I mean, I know my mom and my aunts, you know, they looked beautiful when they were older, but
They did.
yeah.
Well then, I
You don't
can't
have
take
a-
any credit
You don't have
then.
any lip wrinkles. I mean, you're
Well,
you
that's
look
because
stunning.
y'all put stuff in there all the time, every 6
You look
months.
so good.
Thank
You
you.
really look good.
Thank you. It's because of you guys.
Phenomenal.
Well, I'll say you exercise, you do all the things to maintain the rest of your body. Like,
What's
Yeah,
your
the
diet like?
Diet and exercise really
What's your
make
diet consist of?
It's, you know, really, I'm not a vegan or vegetarian, but it's largely vegetable based with a little bit of meat in there. There are plenty of days I go without having any sort of meat, but I really focus on lean, mostly
Good.
fish,
Mhm.
if I have that. A lot of fish.
I'm actually a fan of protein a lot these days.
Yeah.
Yeah. The biggest thing for me is more protein. As we age, we need more protein actually.
Yeah.
So maybe like close to, women should get 1.5 grams of protein per kilogram of their body weight. And all of us do not get that.
I think I probably do because I'm so fanatical about it.
Yeah, maybe you
I think
probably
that
need
helps.
it, the amount of calories you burn. You can basically eat anything the way you exercise, huh?
I don't know, it adds up, it stacks up.
It stacks up.
I have to be mindful of that. I try to fill my tank. If I notice if I'm hungry all the time,
Yes.
I'm low on protein. If I have like a big dose of protein, like a big piece of salmon or steak or something, that goes away.
That feeling of hunger.
Yeah,
Sorry, the scalp one's a little pinchy.
it's all right. Do
And
what
then
you gotta
as
do.
you do your massage, just make sure you massage into the scalp area, into the hairline.
Okay.
And it's kind of subtle, but it does have the effect of pulling upwards on lower face heaviness. That's vertical vectoring in the temple. Sorry.
Yeah, it actually doesn't really hurt up there. I'm not insensate, but it's less sensitive than the face.
Really? That's good. Well, what do you miss about anesthesia world and being in the hospital all the time with work, if anything?
Oh, I miss my colleagues, my
Yeah.
partners. We had a great group there.
Anesthesia group, yeah.
Yeah, but I like the staff that I worked with. So I did all those big pediatric cases. The Shriners kids we used to get.
Huntington is such a great hospital for the OR.
Yeah. And I have really lasting friendships with a lot of the staff that I used to work with, like
That's
the
nice.
doctors and nurses and physical therapists, and even like the pharmacy and the dietary people. They're nice people. They're good at what they do.
I think in some ways we're lucky in medicine because when you work in a hospital, you have a little community. Like you get
Yeah.
to stay in touch with some people. A lot of people, they leave college and they don't have that whole friend structure community anymore.
Yeah, it's hard to maintain when you get older and you have
Mm-hmm.
kids and family and life and
Yeah. joke around a lot in the OR. So that is fun. Let's see, let's put a little droplet in your mid-chin. So everywhere we place the Sculptra is where I want nice pretty volumes and maintenance of youthful, facial structure. So we've got her coming up, up, and up. Looks good. And you have under eyes to do next.
And then lips and then neck.
Wow.
And then quote.
Okay.
Start at the top and go to the bottom.
Smile. Amazing. Okay, that'll do the trick. Let's do the downturns. Okay, a little pinch, sorry. Okay, great. Awesome, that's gonna look good. Next up is the under eyes. You're still with us at this point, yay. It's like a little full face rejuvenation. And I'm going to use a very thin filler here because the skin is thin. And actually we'll use a cannula just to prevent bruising tendency.
This stuff has made all the difference in the world.
Yeah. She asked for it by name because Beltero is a great one. I use this a lot in the under eyes. And the cannula is a blunt tip device. It's not a needle. It has the ability to come in there without too much bruising. It's a lot more safe. A little pinch right there. I want to place our under eye filler nice below the orbicularis muscle. In very small amounts. Little micro droplets. I think the biggest mistake I see is people get too much filler and they get bloated and puffy here in the injection in the wrong plane because lots of people are injecting when they don't have the experience. And if you're an injector and you're watching, hopefully you take time and learn and don't rush into areas that you're not super comfortable with. And go to the OR, go to the cadaver lab and dissect and learn. Let's have you open your eyes to look upwards. There you go. Okay, and then we're going to come on the outer aspect of the eye. And then one of our goals is to not try to look too young, because remember, your face has to match with who you currently are, and it's possible to look like you're trying too hard, and we never want that because it just looks artificial. So we will have a few crinkles and laugh lines and evidence of going to Antarctica, but that's just a few. Just a few. I think how you look is so important to how you perceive who you are in the world, right? Like, I don't know if you get up and go to Antarctica if you let yourself go and looked withered and not so refreshed. Would you?
Mm-hmm. It's a big confidence builder. I'm not afraid of aging. I'm happy to look my age, but I want to age gracefully.
Mm-hmm.
And I don't want to look like I'm 30.
No, I don't think any of us need to go backwards. Eventually, we're going to stay 41, right? Forever 41.
I'm pretty happy about turning 60. Some people are like, oh, I
It's a
didn't
big
tell
one.
anybody. I'm like, I am totally owning it.
Yeah,
It's a big,
it's
it's
a
a big
one.
number.
It's a big one. I don't know. It's hard to get women to own their age. It really is. Because, like, society really, after age 50, tries to make you irrelevant and, outdated.
Yeah.
Cindy Crawford turned 50, and that was it. She disappeared, and her daughter took over.
Yeah.
And I just feel like, wow. But also, like, beauty expectations and beauty standards are crazy wrong. And relax. Good. Great.
You have a whiteout.
Chin dimples. Good. And then wiggle your nose like a bunny. Are you trying to break it?
I said, you have the nice one, I just threw it on the floor.
Is that Botox?
Yeah, just for bunny lines, mouth corners, and downturns. And chin dimples. And smile. Good. And relax. Pucker. Okay, relax. Okay, good. Now lips. And a little lidocaine.
One time when I did this, I don't know what I did, but my right eye wouldn't close for a while. Like,
That's what I came to. The temporal branch of.
I drove my antique Volkswagen here, and it's a stick shift, so I had to like hold my eyelid down
To drive.
to drive.
I think you called from the parking lot that time, and you're like, "What's going on with my eye?"
It was, and then I learned don't ever drive a stick shift when I'm going to come here in case my eye does that again.
That's just temporary because
Yeah.
with Sculptra, we put some lidocaine in here, so everywhere in the whole face is the muscles are going to be, you know, for an hour a little bit out of commission. So this is the area where I tend to see the most elasticity and crepe tissue changes, you know, when you kind of pinch and you can see the skin. See, there's an example of what crepe looks like, but at rest, her skin looks really good. It's very padded. But like if I really want to show you what we're treating, it's this textural change.
The first time we did this, we just did a little bit.
Yeah.
And then when I came back 6 months later, there was such a difference between that part that we did and the rest of it that we did the whole thing.
Yeah. How far down do you want to go today?
It's whatever you think.
I'm thinking just right in here.
Okay.
Yeah. The next time we'll do your décolleté too.
Okay.
I'm gonna save you some travel budget. What's the next country? The next adventure?
I don't know. I'd really like to go to Vietnam, Thailand.
Oh yeah.
I need to go diving again, though. I want to go to the Philippines and
Oh my
dive.
God, you're so adventurous.
I know.
I'm
Jeez, I
fine.
feel like a lazy slob. Jeez, I'm just.
Well, you're all over the place.
Hawaii, that's it.
My life is so boring compared to yours.
You know what? The pandemic really did me in for a while, so I'm trying to make up for lost time.
Good for
Honestly, yeah. And I'll say, like, what a lifetime experience. Just climb Mount Everest. It's an honor to have cool patients like you. I love it. Okay, now you get a lovely full face massage and neck massage from
Wait,
Miss
we
Carmen.
need to do lips, baby.
Okay, we'll do
Am I
lips.
okay over here?
Yeah.
Did you put some over there? I didn't
I
even feel
did.
it.
This direction. We went that
You
direction.
feel it.
Yeah, I go pretty fast, but let's do lips.
Lips.
Let's do lips. After you do your Sculptra treatment, we want patients to massage the rule of 5. So for 5 minutes, 5 times a day, for 5 days, we're going to be massaging circular massage, temples, mid-face here, the preauricular area, or the pre-jowl area, and then the piriforms. And then don't forget we did your high temporal hairline, so 2 finger breaths in right here.
Yeah.
And then the neck. Your temples will be quite sore when you go to chew and stuff like that. You'll really feel it, so not to worry, that's normal. Okay, open your mouth a little bit. And then I'm gonna do for her some lip border. We want some more outlining. That way we don't get crinkles around the lips. And then we'll do a little vertical height. Can our esthetician take a few more ladies back?
There, she's busy.
Great. Okay, let's do one more. We're just doing a half syringe touch up on her lips because, you know, I'm a fan of natural and I want her to retain like her normal lip structure, not get overdone. But definitely when your lips feel deflated, it looks a little older, so giving that nice volume back looks good. Can I get some ointment too? How's sensitivity? Okay?
It's okay.
Honestly, you're a trooper. That's like the number 1,000 needle stick today. So
Yeah.
I'm sorry for all the poking.
It's gotta be.
We gotta do what we gotta do. This lip looks a little smaller, so let's do a little more here. Okay, better. Let me show you how that looks and make sure. That's good. A mirror here. a little touch more if you want any more.
Do you do any out lateral, like out
Yeah,
in
let's
here?
do the corners.
Yeah.
Yeah, that's a great idea because you
Yeah.
start to get these long horizontal lines,
Yeah.
which the mouth can look stretched. So it's nice to treat the corner of the mouth and the actual line itself too. See, you have a good eye. Caught that. And then we don't want to put a ton there, but just enough to turn on some hydration and collagen production there. Okay, that looks great.
That's it? No more lips?
Yeah, that's better.
Very good.
Yeah, I'm not gonna bruise too bad.
I don't think
I can
so.
tell.
Possibly just on your
Yeah, right there is the only
cheeks,
place.
maybe just there.
Yeah.
Yeah, hopefully.
Yeah.
All right. Well, it was so fun, Kat. Okay, was that an amazing treatment or what? And what a client, what a beautiful, adventurous spirit. I love it. I hope you've noticed what Sculptra can do for the face. This idea that you've had 10 years of sculpturing looks so good at 60, no surgery. You guys, you need to come visit. So, thanks so much for tuning in and watching our channel. It's Beauty by Dr. K. That's my handle on Instagram and everywhere you can find me there. And don't forget to subscribe and like and watch again for more crazy adventures with Dr. K and her amazing patients.
I endorse.